Right. At AACR at 2025 meeting, we're presenting a preliminary results from our pilot study of circulating tumor DNA as a liquid dynamic biomarker of recurrence risk and whether or not it's an intervention that we can address in patients with microsatellite instability, microsatellite unstable tumors. So this is an MSK sponsored trial where 174 patients were screened with 16 solid tumor types, including gastric, esophageal, colorectal, endometrial, among others. And microsatellite instability, as you know, occurs in a rare subset of cancers in up to 6% of solid tumors and is a predictive biomarker for response to immune checkpoint blockade. In metastatic setting, we know that some patients can have a durable and complete response, but we don't know whether or not treating these patients in adjuvant, so postoperative setting, will be helpful. So this MSK-sponsored trial screened 174 patients with various solid tumors who underwent R0 resection and completed all standard adjuvant chemotherapy or chemoradiation, and then had a ctDNA analysis that was performed using our internal MSK Access panel, which is a next-generation sequencing liquid-based biopsy. And of those 174 patients that were screened, again, across different MSI tumors, 20 patients, or 11%, were found to be ctDNA positive, and we defined it as having at least one mutation in circulating free DNA, which was identical to that of the primary tumor. So it was a tumor-informed analysis. And then of those patients, 13 went on to receive 6 months of pembrolizumab. Among them, 85% or 11 patients achieved ctDNA clearance with median time to clearance of 4 months. So we actually exceeded our pre-specified endpoint of 40% clearance, and we did better than we expected. And at 2 years, recurrence-free survival and overall survival rates were estimated to be 64% and 92%. So although most patients cleared ctDNA and the primary endpoint was met, 5 patients recurred despite initial ctDNA clearance. We also looked at patients, 6 ctDNA positive patients that were ineligible to receive adjuvant immunotherapy because they developed radiographic evidence of metastatic disease prior to initiation of pembrolizumab. And all of those 6 patients experienced rapid recurrence within 2 months of ctDNA result, with a median recurrence-free survival of less than 1 month. It's 0.8 months, and none remained recurrence-free at 2 years. And then in contrast, among those patients that were ctDNA negative, so 152 of 174 patients were ctDNA negative and who did not receive immunotherapy, only 11, so only 7% experienced recurrence. Again, highlighting that ctDNA is an important biomarker, and in MSI patients, it's pretty good at selecting those patients who will not recur if they're ctDNA negative. And median recurrence-free survival and overall survival were not reached in this cohort, with a 2-year recurrence-free survival and overall survival rates of 94% and 99% respectively. So, to summarize what I discussed, overall, our ctDNA clearance and these findings exceeded our expectations. And they highlight that ctDNA is a potential biomarker to guide escalation and potentially de-escalation of therapy in MMRd tumors, irrespective of tumor origin. We certainly need a larger study in the prospective study to confirm these promising results and refine treatment strategies. And again, thank you for the support for cycle survival and then MSKCC, the Precision Prevention Intervention that sponsored this study.